Hi, my name is Bridget, and I'm a board-certified physical therapist with Froedtert and the Medical College of Wisconsin, and I've been practicing since 2011. I earned my undergraduate degree through Ripon College and then went on to graduate school to pursue my doctorate of physical therapy degree from Concordia University in Mequon. After graduation, I was offered an opportunity to go ahead and broaden my skill set in manual therapy as well as my knowledge base with a year-long intensive internship with Bellin Health in Green Bay. With that experience, I was able to gain a little bit more knowledge and insight to better treat my patients, and I continue to take some of that knowledge and experience and evolve that into my practice today. As a physical therapist, I see patients in all different chapters in their life. My primary focus is on musculoskeletal conditions, primarily of the spine, including but not limited to cervical radiculopathy, mechanical low back pain. I'll also treat rib dysfunction as well as your weekend warrior kind of projects, your acute sprains and strains from a variety of joints within the body. More recently, I've expanded my practice to also include pelvic floor dysfunction as well. I believe that the body has within itself all of the necessary tools and instruments needed to be able to maintain health. My role as your physical therapist is to be able to capitalize on that in order to make those gains. I do that by collaborating with the patient as well as their family and other members of their healthcare team. I really strive to understand where they're coming from by listening to their individual needs and wants with coming to rehab, but I also foster that by incorporating some of the latest research and evidence-based practice. And with that, I'll then go ahead and go forward and develop a treatment plan and devise a plan of care that's both effective and efficient for the patient. And hey, if we can have fun along the way, that's even better. My career is incredibly rewarding. I get to not only see how fascinating the body is to treat and recover itself every day, but I also get to meet really wonderful patients along this journey. Oftentimes these patients come in and they're hurting, they are uncomfortable, or they're experiencing a lot of frustration with some of the symptoms that they're presenting with. What's really neat about the process is within a couple sessions, they're oftentimes feeling better enough to kind of continue on their own. And with that, it's such a privilege to be able to have and foster some of that ability throughout their journey. And I love to be a part of it. I want the patient to know that any sort of discomfort or pain is not normal. I want to be an advocate for the patient to empower them to know that physical therapy can help them along their journey. I look forward to seeing the patient in the clinic. Outside of the office, if I'm not attending continuing education courses, I'm usually spending time with my 2 kids and my husband. You can typically find us outside in some sort of adventure, whether that's kayaking or biking or hiking some of the beautiful state parks that we have around us. If not, we're probably inside playing a really good board game because we love family game night.